Now, this is a key slide. You don't have to guess on how to shape a culture of health. There is actually a framework. Now, I've been in this employee health and well-being space for probably 23 years, give or take. And I've been at Hopkins for 9 years. And just as I was leaving Blue Cross Blue Shield as the medical director of prevention and starting at Hopkins, I took a 2-day training program from my now colleague, Judd Allen, who used a previous version of this framework to help people understand how we can shape a culture of health. Now, there's a few things to point out here. One, remember the definition of culture of health, a collection of common beliefs and behaviors shared amongst a group. Okay, so having a diabetes prevention program is not the same as having a culture of health. Having employees, in this case, regularly choose healthy foods that prevent diabetes, regularly walking that prevents diabetes, that's culture. So there are 6 domains. They are placed here around the figure in indiscriminate order. No one is more important than the other. There are definitions on the side. And you'll notice that these spheres overlap, the Venn diagram. And that's because these domains don't have clear boundaries. They often interdigitate. They overlap each other. It's one of the beauties of this social science, this creation of culture, is that you can impact behavior on so many different levels. When I was about to start working at Hopkins, I was thinking about this culture of health framework, and I knew I was going to follow this framework, but I wasn't sure what my goal was going to be, my first goal at least. So when I got to Hopkins, one of the things I did earliest in my tenure was to walk around the campus and try to get to understand this employer better. And so as I was walking around campus, I was in deep thought. And in fact, I was looking down at the sidewalk when really I should have been looking up. But I remember where I was on that sidewalk when I recalled something, a light bulb went off in my head. And I'm like, I think you just passed something that you should look at. I think you just passed a fire truck. But in fact, I didn't pass a fire truck. I passed a soda truck. And it was the biggest soda truck I've ever seen. But there was more. I paused to understand this picture, this irony, this soda truck sitting outside of a world-class hospital. And I noticed the E on the sign above. That E stands for emergency. That area was the old emergency room entrance, now a loading dock. And the irony did not escape me. And I knew from there that my first culture change at Johns Hopkins was going to be to create a healthy beverage culture.